Namaste. I am Dr.Somanath Vasudeva. I am the head of the Department of Neurology at Apollo BGS Hospitals, Mysore. Stroke is a medical emergency. It is the second largest cause or second commonest cause for death in the world after heart attack, which is just like a heart attack. When it happens in the heart, it's called a heart attack. When it happens in the brain, it's called a stroke. Stroke is even more deadlier than heart attack because not only does it produce or not only does it cause death, but it also produces permanent disability for the patient. So if the person or the patient affected is a breadwinner for the family, the whole family is affected by the stroke. So if you delay treatment, then that disability is going to be there with you for life. It may be in the various forms like permanent loss of speech and language, permanent paralysis of one side or all the limbs, one side of the body or all the limbs, permanent difficulty in walking, loss of control of bowel and bladder sphincters. So various symptoms depending upon where the stroke has happened. So it is not only death, but it's the disability also which makes stroke a very important medical emergency. And the good news is that treatment is there for stroke now, unlike in the earlier days. We have got the state-of-the-art treatment at Apollo BGS hospitals. We have what is called as IV thrombolysis, wherein we give an injection to remove the blockage or dissolve the clot which produces the block in the blood vessels. We also have mechanical thrombectomy, wherein we put in a wire which goes up to the site of block inside the artery, removes the clot and restores blood supply to the brain. But unfortunately, if delayed treatment, all this treatment is not possible. And then the routine treatment of stroke will not help the patient in any other way than just preserve his disability. So the good news is that there is treatment, effective treatment for stroke, and the only factor being you should reach the hospital as early as possible. That is why we are emphasizing on this 4.5 hours deadline. You have to reach the hospital as early as possible, not before 4.5 hours, but as early as possible, so as to complete all the necessary investigations and start treatment before 4.5 hours. The earlier the better. Is just because it's 4.5 hours doesn't mean that you should come within 4.5 hours. You should come as early as possible, because every minute, every second, we have millions of neurons dying. So it has to be as early as possible. And if you give that treatment, be it IV thrombolysis or mechanical thrombectomy, the chances of getting a near normal recovery is much higher than with a regular treatment. But the important feature is time. Come to the hospital as early as possible